Oh, yes. Are we ready? Is that correct? Can everybody hear me for the most part?
Raise your hand if you can't hear her.
Okay. Well, welcome, Jim. Susan? Hi. My name is Dr. Martin Rochlin, and I know you guys have come to see me for some couples work or some work today. I think maybe, I'm not sure exactly what you're here for, but we'll get into that. Before doing that, I have an informal set of questions that I ask people that I work with. And I'm hoping it'd be fine for me to ask you those questions and kind of jot down some notes as I do that. Would that be agreeable?
That's fine.
Yeah, it's good.
Okay, all right, great. So I'm just a little confused. What's the nature of the relationship between the two of you? Is it maybe father, daughter, or best friends, or?
No, we're a couple.
Oh, okay. So you guys are a couple. So like mixed orientation, like you're gay and you're straight.
No.
So are you both breeders, or are you both hetero, or?
We're heterosexual.
Oh, okay.
Yeah, we're great.
Just making sure. Okay. So how long have you been together? Like a couple weeks, months, maybe a year, or?
We've been together like 5 years now.
Yeah, that's right.
Oh, wow. Okay, 5 years. Huh. And have you both always been hetero and always liked people of the opposite sex, or is this the first time that you've been with someone who's, not the same sex as you?
I've always liked boys since I was a little girl, and gosh, let's see, I've had 3 significant relationships. 4. This is my 4th with Jim. 4th relationship with someone of the opposite sex.
Okay.
And for me, I've always liked girls, but I was just too afraid to ask someone out, especially women. So my relationship with Susan is my first relationship.
Okay. And so, I guess, what do you think has caused you to be hetero? I mean, don't you think it's possible that maybe this lifestyle is something that each of you will grow out of, and then the relationship will dissolve itself, or?
Well, my parents, my pastor, my grandparents, a lot of my friends, say the same thing, but I don't think it's ever going to happen. I think I'm this way because, I'm heterosexual because I was born that way.
Yeah, I agree with that. I think it's the same for me too. I don't know, I think it's just something genetic. It happens, you don't have any control over it. So, yeah, I guess in the end, I don't really think about why I'm heterosexual. I just am, and I'm fine with that, and I know who I am, and I know Jim loves me, so.
Yeah. Well, I think we can all agree that all of us, really all we need is love, and to be loved. But ultimately, don't you think that maybe it would just be easier if you could just love someone of the same sex like everybody else? I mean, wouldn't that just make it easier? And I really mean this respectfully, but don't you think, I guess it could be genetic, but maybe it's just a matter of you just haven't been with anybody of the same sex, and maybe if you were with someone of the same sex, then you would realize that, that's just a better way to be.
I've heard that a lot, but I really don't think kissing someone of the same sex or having sex with someone of the same sex is going to make me like men in a sexual or intimate way, because I just like women.
Hold on, Jim. I don't know, I've had a little bit more experience in this area because I've dated more and had more committed relationships. So, like I mentioned before, I've had 3 heterosexual relationships. This is my 4th, and they haven't been that meaningful to me, so I didn't even mention it, but I've dated like 5 or 6 women before, had sexual experiences with women, and I knew without a doubt from those experiences that I in no way liked having sex with women, so I definitely was not a lesbian.
Well, why don't we go ahead and move on? What do you
I think that's fine.
Okay. So one thing we do in marriage and family therapy is we construct genograms, where we trace the patterns that have ran in your family, looking for patterns that might be adaptive as well as ones that might be maladaptive, ones that are more positive that we want to continue and pass down to legacy, and others that maybe we would like to not continue because they're harmful. And normally we do this for couples together, but since I know you guys aren't married because it's not legal in this state, so what we'll do is go ahead and construct 2 separate genograms. So Jim, would that be okay?
I suppose.
Okay, so I have you here, and then, you've told me that you're sure that heterosexuality is something that's genetic, so I'm assuming that there must be many other examples of straight people in your family. So who is there that I can add on here that's...
No, there isn't.
That's curious. I'm very confused now. What about for you, Susan? There must be many, many, many examples.
No, I had, my father's parents were straight, actually.
Okay, all right. Okay, so that makes sense. So I would put, lesbians here, and then you said that it's your father's side?
Mm-hmm.
Okay, so let's see. All right. Okay, so straight couple there. So I guess my question then is, aren't you worried about the pattern then that you will pass on in the future to your potential lineage? I mean, if somehow you're able to have children biologically, not through surrogacy or adoption like most people, but through really high risk overpopulating straight sex, aren't you worried that heterosexuality is going to continue? I mean, aren't you scared to pass that on to your children? I mean, well, sorry, but today that's all we have time for. So we'll go ahead and continue with our assessment next time, and then we can get into what brought you in. Okay? Thanks. Welcome, everyone. Let me adjust.